Usually with automatic thoughts, automatic thoughts, we can really figure out how valid they are. With the core beliefs, I have to tell you, I don't buy into patients' negative core beliefs. If there were a different patient, let's say Mark might act in some really unlovable ways. But that doesn't mean that he's through and through an unlovable person. Mm-hmm. And I think it's important for me to have that attitude. Mm-hmm. Okay, so when we're talking about the core beliefs, we usually need to use both intellectual techniques and also more emotional level techniques. Mm-hmm. So the intellectual techniques might be this kind of Socratic questioning that we do, trying to determine the validity, looking for alternative explanations, and so forth. Mm-hmm. We also will do behavioral experiments with clients. So the behavioral experiment to test the idea that Mary is unlovable would be to have her call a series of people. Maybe, again, we might do some role-playing to make it more likely she'll be successful, and find out, indeed, whether they want to spend time with her. We also might use a lot of imagery techniques when we're working with core beliefs. And we know we need to use these more experiential, emotional level techniques when clients say to us, you know, I understand intellectually that I'm not an unlovable person or a bad person or a completely incompetent person, but in my gut I still feel that way. Mm-hmm. And what they're basically saying is that the intellectual techniques were necessary but not sufficient. Mm-hmm. And that they really need to address this at a different level.